Welcome back to Medical Tubemade. My name is Jay. Today I am going to talk about Modifier 25. This is Modifier Part 2. In this video I am going to explain all about Modifier 25, like definition of Modifier 25, example with scenario, when not to use Modifier 25, when to use Modifier 25. So let's get started. Modifier 25. As per AMA, American Medical Association, CPT book defines Modifier 25 as a significant separately identifiable evaluation and management service by the same physician on the same day of procedure or other services. Simply, evaluation and management and procedure has to be performed on same day by same physician. Then to indicate that on the same day CPT code was performed. Then Modifier 25 can be used in other situations such as with critical care codes and emergency department visit. Not used to report an evaluation and management service that result in a decision to perform surgery, because it's a that time we can think about Modifier 57. Then Modifier 25 can be used for outpatient, inpatient and ambulatory surgery center hospital outpatient use. Simple example: suppose patient came to office and evaluation and management performed plus laceration repair performed by same physician on same day. So that time code should be evaluation and management code, suppose 99213, and CPT code laceration repair, that is 12001. In this case we need to assign Modifier 25 to 99213, and Modifier 25 always going with evaluation and management code. Here concentrate on example. A patient visit the cardiologist for an appointment complaining of occasional chest discomfort during exercise. The patient has a history of hypertension and high cholesterol. After the physician completes an office visit, it is determined that the patient need a cardiovascular stress test, and that is performed that day by the same physician. Here office visit means evaluation and management performed, and on same time cardiovascular stress test performed by same physician on same day. So coding will be like that. So evaluation and management visit code, if it is established patient, means suppose 99214 and cardiovascular stress test 93015. So the Modifier 25 is added to the evaluation and management visit to indicate that there was a separately identifiable ENM on the same day of procedure. So final codes will be like that: 99214 with 25 modifier and 93015. This is cardiovascular stress test. So as per this scenario, these two codes should be assigned with ENM with 25 modifier. Some examples of when not to use the Modifier 25. Do not use a Modifier 25 when billing for services performed during a post-operative period if related to the previous surgery. Then do not append Modifier 25 if there is only an evaluation and management service performed during the office visit. No procedure done. Then do not use a Modifier 25 on any evaluation and management on the day a major 90 days global period procedure is being performed. Then next, do not append Modifier 25 to an ENM service when a minimal procedure is performed on the same day unless the level of service can be supported as significant separately identifiable. All procedure have inherent ENM service included, and patient came in for scheduled procedure only. So last both the scenario you can understand in next example. So patient came in for scheduled procedure only. So this is the example. When a patient is scheduled to come into your office for cardiovascular stress test, and the physician also complete history and perform a limited examination specifically related for the stress test. So your office should be only code for cardiovascular stress test, that is 93015. Here patient came for scheduled procedure or service like cardiovascular stress test, and physician complete history and limited physical examination, but it is completely related to the stress test. So no need to build ENM and Modify 25, because Modify 25 always build with ENM codes and build cardiovascular stress test CPT 93015 alone. A few rules to remember when using the Modify 25. Modifiers are needed to inform third-party payer of circumstances that may affect the way payment is made. The modifier tell a story of what is actually done. Always link the modifier to the ENM CPT codes. That means Modify 25 is a ENM code. So always assign with ENM CPT code. It is not necessary to have two different diagnosis codes. Need to document both the ENM and procedure. Means ENM and procedure, both the documents should be available. Need to use Modify 25 when ENM office visit plus preventive service are done, like suppose 99214 plus 99396 preventive service. If the both the services are performed, that time assign code 99214 with Modify 25. Then last, when you submit a claim to the insurance carrier that is coded with the Modify 25, you are telling the carrier to pay for the both ENM visit and the minor procedure also. So this is only our today's point, Modify 25. If you like my video, then please like, share and don't forget to subscribe Medical Tubemade for upcoming video notification. Bye bye, take care, stay safe.